and what are the outcome that we are supposed to get, not only from this training and even from the other training programs that you are going to conduct in the field at the state level or even the regional level or even the district level. So there should be some structure, cascading trainings to be undertaken over a period of next 1 year. That is what we request to you. With your support of the concerned state governments, you have to undertake this training program. As we are here in the morning session of the objectives of this training program for the metabolic disorders, specifically I would like to brief you why we have prepared these standard treatment guidelines. You may be knowing that some of the research councils, some of the national institutes previously prepared some kind of standard treatment guidelines. One is, of course, prepared by the Ministry of Ayush, wherein almost more than 16 disease conditions, including the diabetes mellitus, was part of that. And in addition to that, Central Council of Research in Ayurvedic Sciences also prepared some of the STGs previously. Somehow these STGs has been limited to their particular what you call contextual background itself actually. For example, whatever the CCRS has prepared, it has not been appropriately percolated into the entire states and UTs. Even the what you call the Ministry of Ayush guidelines is actually a standalone one actually. So at that time, we have never thought about how to converge, how to have that kind of referral criteria as far as the STGs are concerned. And that is why when this Ayush Vertical is a new institution that we have created in the Directorate General of Health Services in the Ministry of Health and Family Welfare to oversee all these activities. One of the major activities is preparation of the STGs actually. So you may be knowing that there is a committee in the Niti Aayog specifically to address various kind of initiatives in the context of the integration. So that committee also emphasized to identify, to prioritize the disease conditions and to prepare standard treatment protocols. So one of the mandate which was given to us is to prepare the standard treatment protocols along with a clear algorithm actually. At what stage a patient has to be primarily addressed for their disease conditions and at what stage they are supposed to be referred, if at all, based on their specific strengths. Then, you know, our country is specifically have different set of healthcare institutions. Even for Ayush, it is there. So you may be knowing that Ministry of Ayush has developed Indian public health standards for Ayush hospitals and Ayushman Arogya Mandir Ayush. So are you aware about that? Yes. So under that IPHS, there is a certain quality standards to be adhered by each of the institutions. So who is responsible to adhere that quality standards? Whatever the logistics and facilities has to be provided, of course, by the state governments. But whatever the workflow, whatever the quality parameters to be achieved within that healthcare institutions, it is the responsibility of the medical officer in charge who is actually running that healthcare institutions. So one of the important paradigm program is actually standard treatment guideline. So adoption of the standard treatment guideline in the healthcare institutions, whenever this IPHS is completely complied by the states and UTs, that is very important, one of the strategy. So for that purpose also STGs are required. And when we started it, we thought about developing on priority disease conditions where Ayurveda and other systems of traditional medical system have an relatively stronger position. So based on that, we started with the musculoskeletal disorders, under which rheumatoid arthritis, osteoarthritis, and even some of the lumbar spondylosis, like that, some of the major disease conditions where we manage at OPD level, at IPD level through Panchakarma and other things, and even for the rehabilitation, what are the specific criteria that has been developed in the previous STG. And we have also tried to recapitulate which are the essential medicines which are required for managing these conditions. And if you go through this document, even for the metabolic disorders, you can see that in addition to the essential drug list, some of the more medications have been indicated, which can be locally purchased or which can be adopted in the state formulary, so that at least there is a wide spectrum of medicines available to the physicians at the field level for managing these disease conditions. So for all essential drugs, Ministry of Ayush is supporting the state governments to procurement of the medicines actually. In addition to that, if at all anything is required actually under the local purchase criteria, the state governments can purchase that medicines and provide to the patients. So based on that, these specific standard treatment guidelines have been evolved. Along with that, there are a separate section for dietary practices actually. You know that the basic strength of the traditional medical systems are actually aligned with these dietary prescriptions. If at all dietary prescriptions are not there, then what I consider that 50 to 60% of our interventions are not sufficient actually. That means only 40% we are actually managing the cases with the medicine, specific medications. The remaining 50% is adjustment with the dietary prescriptions actually. So specific therapeutic diet has been made a separate entity in these metabolic disorders. In addition to that, in all medical systems, whether it is Ayurveda, Siddha, Unani and homeopathy, we have tried to integrate into yoga. And particularly, you know that all the BAMS curriculum itself, yoga has been integrated. So you need not take a separate guideline for the yoga. That is what we thought actually. In each and every disease condition, whether it is dyslipidemia, whether it is non-alcoholic fatty liver disorder, or even for the obesity, appropriate yoga module should be integrated so that with the national level expertise from the yoga experts, very specific posters, pranayama has been specifically integrated into this module. So that also should be taught whenever you are actually undertaking a further modular training, further training programs in the field level medical officers. That also should be part of that. Today we are consolidating the training program into only 1 day, but you can expand into 2 days. For example, integration of the yoga, you can make a very specific session. Similarly, you can add each of the disease conditions, you can have separate expertise you can take from the state governments. So based on that, you can dovetail whatever the training program into 2 days, so that would be more appropriate. Today, we are actually consolidating with only 1 day, because already you are a master trainers and you have prima facie having a knowledge about how to how these standard treatment guidelines have been evolved, and how because many of you are already in the teaching hospitals also. So that kind of capacity already you have. That is why we thought that today we will give you only 1 day's orientation. So as far as this background is, what I would like to advocate is that we have a large number of institutions in the public health. See, more than 3,885 Ayush hospitals, which are actually standalone. Standalone Ayush hospitals have been reported by the states and UTs, many of which are already supported under the National Ayush Mission also, for whether it is upgradation, whether it is for the procurement of medicine, whether some of them are also supported for the deployment of the additional contractual manpower. Similarly, we have 37,804 Ayush dispensaries. So out of these dispensaries, some of them may be now converted into 12,500 converted into the Ayushman Arogya Mandir Ayush. In spite of that, large number of Ayush dispensaries are already available, and Ayush, as you know, that Ayushman Arogya Mandir specifically cater, particularly many of the non-communicable diseases are actually particularly reported, and they are you are supposed to manage through this Ayushman Arogya Mandir the various ailments of the population, particularly non-communicable diseases and also these metabolic disorders. So this is the relevance where these large number of institutions we have, at starting from the primary healthcare setup, then secondary healthcare setup, and also co-located facilities. Now it is around 13,000 at the primary healthcare services, community health centers, then district hospital level. There are altogether almost 13,000. Now it is coming that co-located facilities are also available. So there also these STGs should be appropriately integrated within the resource constraint. That is what I am saying, because co-located facilities, that much of facilities may not be available, but there also you can try to integrate these STGs so that at least your allopathic counterparts also have a fair idea enough that these are the patients which are supposed to be referred to their cases, and vice versa also they can have. So in the morning inaugural session, that is what additional DG mentioned, that we should have an appropriate orientation to your allopathic counterparts also, so that they will be also able to later stage refer the cases to you for appropriate management of these metabolic disorders. Then ultimately, what is the outcome of this implementation of the STG? The implementation of the STG ultimately will lead to, there are 2-3 outcomes that we envisage. One is actually appropriate awareness among the physicians on appropriate referrals. Then system-wise hierarchy referrals. Hierarchy referrals, what I mean, for example, you are sitting in a primary health center or Ayush dispensary to that effect. So at what stage you are supposed to manage this case at that level? At what stage you are supposed to refer to the higher center? For example, Panchakarma, it is required. Who decides it actually? From the classical documentation, there may be so many references are there. But to the context, whether at this stage, whether this case is fit enough to refer to the higher center or not, that will be decided by you alone. How you will decide it? Based on certain standard norms. So that norms from where you will get, either from the academic curriculum what you have gained previously and by your experience. But now we are trying to facilitate you that by accommodating it, actually you can definitely refer the cases with very ease. For that, a very specific protocol has been developed. So that is the importance. Second importance is that based on these STGs, whether you can have some kind of documentations. We expect that we will be in due course of the time, we will be circulating you certain specific format in which this STGs implementation is captured or reported back to the ministry, so that ultimately you will get a very specific idea about how many patients have been managed with this STG and what is the specific outcome from that interventions. Currently we have no data. Currently even the National Ayush Mission, whatever we are actually taking these inputs, we may be, Dr. Sridharji, abhi next session mein bata denge, we may be capturing some data, for example, how many major disease conditions in which these clinics are actually, the patients are reported. That is only we are actually getting that information. Apart from, suppose some specific programs are there, that specific program reporting may be there actually. But otherwise there is no specific data on any of these disease conditions. How many patients are reported with non-alcoholic fatty liver diseases? We have no idea, no clue. Even your dispensaries may have that data. That data is disaggregated. But aggregation of the data and sending that report timely to the state headquarter, from the state headquarter to the central government, actually, that would effectively make us to make a very clear-cut policy decision for further strengthening of this program. So that is also one of the important. Second one is whether you know that Ayurveda is highly, what do you call, as per the strength, different manner it is practiced. North, there are certain practices which is predominantly the Saushadis are used, whereas in South, many of the routine manner, kashaya and powders and tablets are used. So even West, maybe East, maybe large number of differences are there actually as far as the practice is concerned. So whether we can make a system wherein everything has been aggregated, That is why national level consensus we have made. That means a technical committee, which is, of course, the Secretariat was Central Council of Research in Ayurvedic Sciences. In that Ayurvedic Sciences Secretariat, we have inducted many persons who are working in the public health, who are working in the government sector, and who are working in the private sector. So they have been contributing to the development of these guidelines so that every flavor of treating this metabolic disorders have been inducted into that guidelines. So based on that, the guidelines have been prepared. And after preparations, again, some consultative process have been adopted, and there was an editorial board made so that finer changes in the whatever the technical content has been suggested by them, that has been incorporated, and finally this has been published by the government. So based on that, and also you have to see that the cost effectiveness at a later stage, there may be certain things. Now also it is there. Many people says that very simple medications we can manage this one. Why we want to undertake this much costly panchakarma therapies? So we have to clearly demonstrate that these treatments are sustainable. That is one thing. These treatments are also, for example, non-recurring. Once you treat these interventions with the specific panchakarma treatment or any other interventions, that is actually major, in a major manner it is non-recurring. And there is a very clear-cut strength for Ayurveda as far as managing these conditions are there by adopting very specific what you call regimes. Then also you have to say that there is a, it is a now time, because as I mentioned in my opening remarks that obesity as a matter of fact has been undertaken by the government of India as a converged action. So under that converged action, every ministry have its own role to tackle it. So massive awareness we have to undertake to prevent and promote, prevent the disease and promote the healthcare systems. So in both ground, actually these STGs will be beneficial. So based on that, we have to prepare certain IEC campaign as suggested by Dr. Gauri, ma'am already mentioned in that morning session that we have to prepare certain IEC activities. So we will be drafting that in English and Hindi, and we will be circulating to you so that in every platform, because you have many activities under National Ayush Mission, isn't it? Some behavior change communication, that for that we are funding. We are funding on for even Ayush Gram, certain Ayush Grams has been adopted in your states, and we are also funding for public health outreach activities or various disease conditions. So in all such platforms, these IEC can be made a major thrust so that the public will be appropriately aware about, and you know that now at a younger age itself, metabolic disorders, metabolic syndrome are actually happening. So in order to prevent it, what are the precautions that the community has to be undertake? All these things can be appropriately oriented based on our science. So as I mentioned that what are the existing gaps of standard treatment guidelines? National Ayush Mission aimed to augment Ayush healthcare and education, yet the quality assurance mechanism remained fragmented. Because so far National Ayush Mission focused on 2-3 items actually. One is infrastructure support, infrastructure development, providing the essential medicines. Then in the 2017, after that we have inducted the public health programs. Even though all these activities we have undertaken, the more or less the inherent quality aspects of prescription, standards, and focusing the outcome, that was yet to be addressed. So based on that, we thought that there is a need of integrating standard treatment guidelines into the implementation of the National Ayush Mission. And also you may be knowing that Ministry of Ayush also, along with the WHO, we have made ICD-11 classification for the Ayurveda, Siddha and Unani systems of medicine. So whenever you are prescribing, at that time, based on this STG, we have to integrate the nomenclature of the disease condition with the ICD-11 classifications. So that will enable what a uniform, receipt of for one disease condition, one identity. So based on that, we have to make our ICD-11 integration also highly relevant. And you may be knowing that in future, all the facilities will be integrated with the ABDM platform, Ayushman Bharat, the digital mission. So based on that, even our Ayush public health facilities are also should be geared up to that kind of standards. So when you are geared up to that kind of standards, then ICD-11 is the only way in which you can integrate these facilities so that appropriately all the disease conditions with the proper STGs, with the proper ICDs 11 classifications, you have to integrate. So all these have been appropriately mentioned in our standard treatment guidelines. Then that is what I told, ICD-11 classification. Then differential diagnosis. So Ayurveda, the system approach is having a wide scope and complexities. So in order to address all these complexities in different classical texts, whether it is Vagbhada, ya Charaga, ya Susruta, so based on that, what are the existing prominent clinical discourse which is actually undertaken by the Ayush hospitals and dispensaries, very clear-cut differential diagnostic and along with the modern diagnosis actually. So modern diagnosis means at a different level, different infrastructure may be available. For example, in Ayushman Arogya Mandir, you cannot expect all the ultrasound or MRI and other things are not available. Only that can be made available at many a time at the teaching hospital level, ultrasound and other things actually. Based on that, a hierarchy of diagnostics have already been mentioned in these guidelines. So that at least we are comfortable. Those practitioners who are sitting in the Ayushman Arogya Mandir are also comfortable. They tell that this is what we are supposed to do. Beyond that, we have to refer that cases. And if at all the patient is having that kind of capacity to undertake this diagnostic, let him do. But otherwise, we will say very categorically, as far as Ayushman Arogya Mandir is concerned, we are having these kind of resources. Based on these resources, these are the activities we are supposed to do. Beyond that, we will refer the cases. So that differential diagnosis, red flag signs and referral criteria, then interdisciplinary management approaches along with the yoga and other systems of medicines, how you can manage, along with the particular dietary guidelines, how you can able to effectively manage. All these are part of the standard treatment guidelines. No unified national framework to harmonize diverse clinical practices, inconsistent diagnosis and treatment protocols across systems and states. Then scientific evidence. One of the important aspects that we have integrated into that, wherever, because you know the triangle of evidence generation. Basically, traditional medical sciences like Ayurveda have documented enough clinical material to understand the different perspectives of the disease conditions. Along with that, what we are suggesting that along with that various levels of evidence, whether it is observational studies, whether it is very clear-cut controlled trials, RCTs, and above that some of the systematic review and meta-analysis which is actually available currently, that has also been integrated into these STGs. Not large number of systematic review and meta-analysis have been available for these disease conditions. Even the limited number, particularly in the context of the yoga, that has been tried to recapitulate and that has been part of these STGs. And whatever the research studies, evidence and very clear transparent studies which have been reported in the Ayush portal, which is a research portal of Central Council of Researching Ayurvedic Sciences, that also has been integrated into this metabolic disorders STG. So I told these aspect variations in practice across regions, modern research methodologies and outcomes data need to be incorporated alongside classical Ayush principles. Uniform guidelines facilitate dialogue and coordination between Ayush and modern medicine practitioners, which is vital for integrative care and effective referrals. So now at various aims and Ayush unit are already been established, and it is expected that a very clear integrated Ayush departments are also forthcoming in the all the newly created all in the Institute of Medical Sciences. So there very standard protocol are required for managing the disease conditions and ultimately for the various kinds of documentation and clinical convergence. So based on that, this STGs is highly relevant. STGs are serve as a foundational resource for newly inducted Ayush medical officers and trainees interns. Somehow, many state governments are now created more number of posts for Ayush medical officers. So while they are inducting, prima facie, some of the state governments are conducting some kind of orientation. But in many states, there is no structured orientations. So there is a need to orient them in particularly in administrative matters as well as these kind of technical standard treatment guidelines. So you can help them whenever new recruits are actually posted in the medical as a medical officer in the new Ayush dispensaries, Ayushman Arogya Mandir or even Ayush hospital, it is your duty to have some kind of training to be provided to these medical officers on these STGs, without which they may be initially able to not able to perform in an optimal manner. STGs provide a credible basis for inclusion of Ayush treatments in public health programs and insurance scheme. So you may be knowing that under the insurance, more than 32 insurance providers have already been now providing Ayush insurance scheme, including the cashless facilities. So STGs are highly very important as far as their assessment as for the patients and even for the acceptance of the claims generated by the various hospitals. So these STGs will also serve the purpose of the insurance providers as far as various disease conditions are concerned. Now we have came it to only 12, because you know this is how tedious the preparation of the STGs actually, because there should be a lot of consensus. Most of the STGs are prepared based on STG consensus and evidences. Evidence, as a matter of fact, evidences are very limited as far as the traditional medical systems are concerned, because the evidence generation per se came for the last 1 decade or 2 decades, not beyond that. Then what we can do? We can do only consensus from the various experts. For example, those who are actually clinicians in the Banaras Hindu University, National Institute of Ayurveda, ITRA Jamnagar, or Government Ayurveda College Bengaluru, Hyderabad, Trivandrum College or Lucknow College. Like so, all these experts have to sit together and then make appropriate recommendations. So based on that, consensus are coming along with the, if there is a specific evidence at a various level, whether it is observational study, whether it is a controlled trial, or with even systematic review, if there is an evidence, that will be given an upper hand. So based on that, STGs have been prepared. Methodology, how we prepared this STG. There was a national level committee which was chaired by Directorate General of Health Services, and we have the members from the directors of the research councils, particularly CCRIS. They have been entrusted with to remain as a secretariat for this preparation of the STG. Then all the directors of the National Institute, then eminent Ayush practitioners and academicians at various part of the country, then modern medicine experts for evidence and integrative alignment. For example, what are the responsibility which was actually undertaken by the modern medicine experts? Mainly, one is actually about the etiopathogenesis in the context of the modern medicine, then the diagnostic criteria, differential diagnosis, referral criteria. The referral criteria was prepared with a mutual consultation, because it is not their perception alone. It is a perception of both actually. Based on that, after due diligence and discussions, actually the referral criteria and the red flag signs have been integrated into the system. Then supporting groups, we have the working groups of system specific experts. There was a further, after these primary preparations, 2-3 rounds of discussions, and after that discussion, then an editorial board was given the task to fine-tune this, whatever the content which was actually produced by this committee. And finally, the document was got approved from the committee. Then multidisciplinary and evidence-based, clinically sound and implementable across healthcare settings, systems covered Ayurveda, Siddha, Unani, Homeopathy, and yoga integrated throughout. Because we thought that in all systems, yoga can be integrated, whether it is Ayurveda, Siddha, Unani, and Homeopathy. And that is why in your respective undergraduate curriculum also, yoga is one of the important part actually. So we cannot separate yoga as a separate STG. That is why we thought that it can be integrated. Then approval and dissemination. The final STGs are formally launched and disseminated through national level master training programs, digital platforms and printed manuals. Then peer review and vetting. Drafts undergo rigorous peer review within Ayush systems and are then vetted by experts from modern medicine to ensure safety and compatibility with the contemporary standards. Priority conditions we have identified. So this was with the due discussions with the modern counterparts along with the strength of Ayush. That is why we thought that obesity, we have a upper hand as far as the metabolic disorders are concerned. Then non-alcoholic fatty liver disorder in public health, this is a very important challenge that we are facing. So there is a clear-cut advantage for the traditional medical system to manage. That is why we taken that disease condition also. Similarly, dyslipidemia. Generally, there is a tendency to underestimate, particularly the dyslipidemia. Generally, people, the physicians also neglect in the early stage. So we thought that Ayurveda is the first hand because, you know, Purvarupa is the important area where Ayurveda can effectively intervene. So that is why we thought that dyslipidemia should be one of the important things so that the disease should not be progressed into any further complications in the metabolic disorders. That is why that disease condition also be undertaken in this one. Similarly, there is a very clear-cut template has been mentioned in that template preparation, some other language came actually. Collaboration of the evidence, research councils and identified national experts collect and synthesize evidence from classical literature, clinical studies and field experience. So this is a standardized template we have prepared. Name of the disease, case definition, introduction, clinical presentation, clinical examination, differential diagnosis, supportive investigation, essential and advanced. Essential at that level, for example, wherever level the physician is practicing, that is essential. Then there are certain advanced one which may be possible only in tertiary care facilities or even at later referral stages. Diagnostic criteria, modern and Ayush system specific. Principle of management, very clear. Then red flag signs, line of treatment. Prevention management, for example, specific abhatya and pathya ahara. Then along with dietary regimen, yoga and pranayama. Curative intervention with respect to clinical diagnosis at level 1, 2, 3. 1 means at a primary healthcare level. 2 means in between that actually. For example, 30-bedded hospital or 20-bedded hospital, that can be generally considered with 3-4 physicians are available, then it can be considered as a level 2. What is a level 3? Your teaching hospitals and even many of your integrated Ayush hospital, if you able to develop that integrated Ayush hospital, 50-bedded integrated to level 3, that will also come into level 3. Then ultimately the referral criteria. So all these things I already discussed with you. Essential drug list, this is very important actually. So at the primary level, we should follow specifically the essential drug list. Whereas in the higher level, you can have some through local purchase and other things, more medicines can be added. Then beneficiaries at different levels, Ayush practitioners throughout the country, practitioners in centers of emerging integrated healthcare like AIIMS and co-located Ayush healthcare facilities. Secondary, these program managers, public health administrators, researchers and training institutes facilitating interdisciplinary and learning and research. Then level 3, we will get even indirect beneficiaries like patients receiving standardized, safe and evidence-informed care, communities benefiting from improved service delivery. So rationale already I mentioned actually, clinical competency बढ़ जाता है, documentation, rational practice in Ayush health facilities. Modular training ensures consistent understanding and uniform application of STG. And always remember that STGs are always evolving. अभी हम जो प्रिपेयर कर रहे हैं, अभी पब्लिश कर रहे हैं, based on your field level practice, you can give your inputs to us so that after 2 or 3 years, we can review it again. Always it will be evolving based on the current understanding, based on the additional, for example, some diagnostic newly आ गया तो वो भी हम integrate कर सकते हैं उसी के साथ. So based on that and some research evidence came in between. So that also can be integrated into that. So that kind of inputs are also important. Diversity in practice styles across systems and regions highlights the need for uniform clinical guidance. Growing number of facilities and practitioners demand systematic training. So all these are the rationale for this training program. Then support material, comprehensive resource packages. You can prepare also some visual aids and patient education tools as mentioned by Gauri ma'am ने already बताया था कैसे हम prepare करेंगे IEC जो के लिए. So वो सभी हम इधर से हम further आपको disseminate करेंगे. Focus area, structure, content and rationale, evidence-based recommendations and practical clinical applicability. So the ultimate outcome will be participants become master trainers to conduct state and district level orientation, creating a cascading training model. So this is the vision to promote standardized, safe and effective Ayush clinical care through competency-driven training. The major goals will be build the capacity of Ayush practitioners to apply STGs consistently, ensure evidence-based and patient-centered clinical decision-making, strengthen health system integration through harmonized treatment protocols and referral systems, contribute to improved public health outcomes through standardization. So system, attitude, knowledge and skills, all these will be integrated whenever this training is actually completed. System means actually whatever the documentation के लिए एक system होना चाहिए, referral के लिए एक system होना चाहिए. Similarly, feedback mechanism. So all these we have to create at the different level of institutions. Then attitude is also very important because ultimately somebody is actually trained in the STGs. Finally, if he is not practicing it ethically, then definitely there is no use of that standard treatment guideline. So state level machinery has to foresee that whether it is actually followed in the field, then only for that simple format has to be developed. Very complicated है तो then it would be field में adopt करना थोड़ा difficulty रहेगा. So what we suggest that very simple format to adopt these standard treatment guidelines has to be prepared, and based on that only reporting system has to be generated. Further orientation skills कैसे करेंगे? Suppose अभी एक orientation आप दे दिया, एक साल के बाद एक reorientation भी दे सकते हैं same metabolic disorders में. So based on that their skills will be can be evaluated as well as they can be upgraded also. तो state level rollout and dissemination के लिए हमने ये suggest किया है, एक तो state level या regional level ये करेंगे. तो continuous, flexible and wide-reaching capacity building, the Ayush vertical is leveraging digital health platforms. हम digital health platform में भी हम use कर सकते हैं इसके लिए. Then resources are disseminated through the national. We will be already circulated. National commissions पहले morning में जो suggest किया था, national commissions को हमने already circulate किया है. But further शायद उनको अभी करना है, बाकी बचा है actually. So we will direct them या request them to appropriately circulate to all the teaching institutions. So all the students, undergraduate and postgraduate students will be oriented as far as these STGs are concerned. So these are the expected outcomes. Clinical competency बढ़ जाता है, strengthened integration with the national health programs, evidence-based data generation, increase patient safety and satisfaction. Ultimately किसके लिए है? ये patients के लिए actually. Patients का outcome will be improved. They can make informed decisions at what stage they are supposed to take from Ayush systems, at what stage they are supposed to refer. So your role is to help the patient to take a decision. Not their decision cannot be taken by you. You are supposed to only support the patient in taking the appropriate decision. So this is the way forward. Training NAM to all states, continuous updating, integration with Ayush Grid and a digital learning platform, link outcomes with accreditation and quality assurance mechanism. So thank you. If you have any specific query on this objectives and proposed strategies and outcomes you can raise now. In fact, when we write to the national commissions, it is their specific role to orient all the practitioners in the country, because you may be knowing that for further renewal of the registrations after 5 years, this much of credits of CMEs or reorientation training program is essential. So naturally, these kind of STG training can be part of that actually. So that we are anyhow to writing to the national commissions to have that kind of orientation programs. Yes. Any other queries and other things? So I request by evening, whenever you are filling up your further feedbacks also, you identify certain, if at all in your state specific bottlenecks are there, that also you can identify, so that if it is very state specific only to one or two state, then we have to take it separately to a state. Otherwise, if it is a generalized some feedback, then that would be more welcome to us actually. Yes, you want?
Actually, you told that essential drug list has to be provided through
Yes,
time or something.
yes.
So any diagnostic tools are also being provided?
Under the Ayushman Arogya Mandir, actually, that is some diagnostic tools has been very minimal. As per the guidelines of the Ministry of Health and Family Welfare, it has been integrated. As far as the Ayush hospitals and other things are concerned, we have tried to capture it in the IPHS, Indian Public Health Standards. So it is expected that the state governments has to undertake that IPHS compliance. So these diagnostics and other things, which is very well aligned with this STGs also. Any other? So after that, I think when we make to the concluding session, at that time, if remaining any doubts are there, we can clear. Thank you all.
Thank you, sir.